Hello, everybody. I'm Aaron Hale with Hale Financial Group. I want to walk you through the first video in a series of recordings that I've done on open enrollment and your introduction to the world of Medicare. For a lot of you, you're aging in, you're turning 65. It's kind of stressful, right? You've never done this before. And so what we want to do is just make this so simple and painless that you're like, wow, I'm really glad I was introduced to you. And thank you, Aaron. So at the end of the day, I want you to know there's several different groups when it comes to turning 65 and aging in. You've got people that are currently working. All right, so when they get to 65, they're not sure what to do, nor does their HR department. Maybe they have a spouse that's working. Should they take Part A? Should they take Part B? What should they do? You've got people that were on retired a few years ago, and now they're on a group retiring medical benefit, and they're introduced to 65 and open enrollment in Medicare, and they're not sure what to do, and they no longer work there, so it's not so easy just to run over to HR. You've got individuals who served in our military, and they are receiving what are called TRICARE benefits for life, or CHAMP VA, or just prescription drug benefits through the Veterans Administration. You've got individuals who purchased Obamacare plans, so individual health insurance. What do? And then you've got individuals, believe it or not, that don't have any health insurance, which is few and far between, but believe it or not, I still run into them. So at the end of the day, there are a bunch of segments, and each one of you can take advantage of certain things to save a bunch of money. And unfortunately, good or bad, a lot of the advisors out there or insurance agents that work in this space, they don't recognize that there are differences and they don't have enough experience. I hate to say it, but most of the people serving these plans have done this less than 5 years. So I'm someone that's been doing this over a decade. I'm a certified financial planner. I'm also a retirement income certified professional. I've been doing this a long time. I've helped thousands of people, and I want to help you too. So what I'm going to do is I'm going to go quick, and I'm going to take you through Medicare in 5 minutes. That's what I call it. Everything you need to know about Medicare. And then if you have any questions after this, please feel free, reach out. I'm also going to send you some information, okay? All right, I'm going to take myself off the screen so I'm not a distraction. And let's do it. Let's do Medicare in 5 minutes. All right. So as you approach your 65th birthday, you know you need to get a handle on Medicare. And what I want to do is I've created a process to save you time and effort so that you don't have to sit down with like 10 different brokers and everybody's going to give you their own opinion. And you're like, golly, am I even getting the correct answers to all this? Because this is important. So I'm trying to create this seamless process that just guides you to an ideal result and enables you to avoid spending hours sifting through multiple documents and talking to numerous sources. So that's what this video, Medicare in 5 minutes, can do for you. But first, we need to address the problems you're facing. You're going through information overload. However, though you're inundated with facts and figures, none of the data is specific to you or your situation. The federal government has created a website with over 60,000 pages of information. And that's nice, but who has the time to review this amount of data? Half of it needs a translator to understand, but who's going to help you? Many representatives don't know the answers or the latest rules or regulations. And here's a real shocker. Did you know that Medicare is mandatory when you turn 65? Most people don't. There is one exception to this, but do you know what it is? And what happens if you miss open enrollment? The Medicare Part B late enrollment penalty is 10% for each 12-month period. And guess what? It's not a one-time penalty. You have to pay it for the rest of your life. Insurance agents are great and resourceful, but after the sale, how often will you talk? Possibly never again. And even if you do, most agents don't understand Social Security planning, tax planning, or investments. You need an advisor who understands the whole picture because it all relates to Medicare. You need someone you can trust, someone who has your best interest at heart. And guess what? That group is us. So let's cover how Hale Financial Group can help you overcome the issues that you're encountering. I'm a certified financial planner and an investment advisor representative, both of which honor the fiduciary standard. I genuinely take an interest in your well-being. You and I will develop a personal relationship, and you can be confident that I'll always answer your phone call or email or sit down and meet with you to guide you to a solution that's appropriate and unique to your circumstances. At Hale Financial Group, we strive to make the Medicare process easy. We're going to give you Medicare in 5 minutes in just a moment. It's an educational snippet that Hale Financial Group designed to teach you the fundamentals of Medicare in a time-efficient format. We're also going to reveal the one exception to mandatory Medicare enrollment. And after going through this presentation, hopefully you won't need a translator. In fact, most of the people that I've met feel like they have enough information to just move forward after viewing and hearing today's material, so they can go ahead and take care of this. However, for those of you who want a more in-depth and detailed look into the intricate world of Medicare, I've also recorded the best PowerPoint in the industry. So watch your inbox over the next few days, and I'll send you an email, and you can watch that one also. By the end of that one, you'll know more than 99% of the public. By educating you, trust is earned. And of course, we have supporting documentation on everything so you know you're getting the truth. And after you've had a chance to soak in all this fantastic information, I'd like to advise you on how to purchase the correct plan, not just sell one to you. All right, let's get started with Medicare in 5 minutes. I'm going to go pretty quick, but you can watch this as many times as you'd like so you fully understand, okay? So original Medicare consists of Part A and Part B. So when you turn 65 and you enroll in Parts A and B, they will cover 80% of your doctor and hospital bills. That's what it means to you, okay? So how much do they cost? So Medicare Part A is what is known as the hospital benefit, and it's free for most Americans. There is no current cost because you've already paid for it through payroll deductions while you were employed or your spouse. It helps cover inpatient care in hospitals, skilled nursing facility care, hospice care, and home health care. Part B is the medical insurance benefit, and there is a premium due for this part. And in a couple of slides, I'm going to go over the premiums for this section. This helps cover all of your doctor and hospital healthcare provider costs. This helps cover all your doctor and other healthcare provider costs. Some preventive services, outpatient care, home health care, and durable medical expenses. Everyone in America pays a Part B premium. And sometimes that's news to people. They're like, what? I have to pay for this? But the reason you really don't hear a lot about it is because most people opt to have the premium taken right out of their Social Security checks. So you don't really feel it because it's already deducted. Now, what if you're turning 65 and you're going on Medicare for the first time, but you're not drawing your Social Security yet? Well, in that case, you'll get billed for your Part B premium a quarter at a time. You'll actually cut a check to the federal government until you finally do go on Social Security. So what is your Part B premium? Well, your Part B premium is based on your income. The federal government uses your tax return from 2 years ago to calculate what you'll pay every month. So everyone pays the base premium. And if you're married and have incomes over $170,000 and you're filing jointly, you'll be assessed a higher premium. And I'm going to show you those numbers in just a moment. But what I'm trying to inform you is Medicare is now means tested. Unfortunately, retirees today kind of have to wrap their mind around the fact that Medicare is probably going to cost more in the future than it has in the past. This is just another aspect that I help my clients with. If you become a client of mine for Medicare, I'd like to sit down with you and talk about how I can help you, increase your assets or have guaranteed income for life, help pay for all this stuff so that you always have great health insurance. All right, so here's the problem we all have. If Medicare's Part A and B are only covering 80% of this tab, what about this section here, between 80 and 100? So you solve this problem with a Medigap policy, commonly called a Medicare supplement, or you enroll in a Medicare Advantage plan. So what's the difference? I want you to think of a Medicare supplement like a PPO. Okay, I'm just using that word to make it simple. You can go to basically any doctor or any hospital anywhere in America as long as they accept Medicare. So that's your new question in life. If you buy a Medicare supplement, you just need to ask the doctor or the hospital before you do anything, hey, look, do you guys accept Medicare? If they do, your Medicare supplement automatically works, and it doesn't matter which company you go with. I think a lot of people get hung up on name brand. Don't worry about it. I mean, There are insurance companies you don't even know about that write Medicare supplements because they just work in the 65 plus arena. You're used to the big names like Aetna, Cigna, Blue Cross, United Healthcare, but there's a whole host of people. Mutual of Omaha is one of the biggest health insurance companies in this country, and they don't work with anybody under the age of 65. So as long as the doctor or hospital accept Medicare, you know your Medicare supplement will work. Medicare Advantage is totally different. Think about it like an HMO type plan. There are some other plans that are Medicare Advantage that are PPO or what are called private fee for service, but the majority of them are HMO plans. And so what you need to understand is there's just a network that you have to go to. You have to go to specific doctors and hospitals for that plan, or you may pay more, or all of the costs for that matter. All right, there are advantages and disadvantages to both types of supplemental plans, all right? So Medicare supplements have a premium, okay? So they cost money. And to some people, that's a disadvantage. Now, on the other hand, one of the draws to Medicare Advantage is a lot of these plans have a zero premium, meaning there's actually no premium due every month. So you start doing some research and you think, wow, this is great. This doesn't cost anything. I think I'm going to get one of these. You just have to be careful and understand what you're getting into. I love Medicare Advantage for like my veterans. I think they're fantastic to kind of add on to their VA benefits. But if you travel or you're young or you have a second home, it just really, it makes less and less sense to go the Medicare Advantage route than a MedSup. So think of Medicare Supplement as a pay me now. You're basically paying this monthly premium for coverage. But then when you go visit your doctor or a hospital, your bills could be nothing or just minimal. You don't have any co-pays anymore, and you don't have any co-insurance. And on one of the plans, you don't even have a deductible. So, I mean, it's like literally you get no bills. But Medicare Advantage, think of it more like pay me later, because while you won't have that monthly expense for the policy, you will be responsible for paying deductibles, co-payments, or co-insurances for the services that you receive. Okay, the last main difference has to do with the doctor flexibility. Many of my clients, they're just young at heart, right? They're active, they're traveling, they're all over the place. And with the Medicare supplement, their location doesn't prevent them from receiving covered medical care. You can get treatment from any doctor or facility that accepts Medicare anywhere in the country. And with Medicare Advantage, technically that's not the case. With these plans, coverage is generally limited to the county you live in. So, for an example, if you live in Maricopa County in Arizona, but you're on vacation in Florida or somewhere else, you really don't have medical coverage for common illnesses or infections because you're out of network. Now, if there's an emergency, that's different. But for your ordinary sicknesses, you have to come back to Maricopa County to receive covered treatment, which isn't very convenient. So after weighing the pros and cons of these two options, my clients typically aren't drawn to Medicare Advantage. They kind of seem to like the Medicare supplement plans a little bit better, especially while they're younger. I think Medicare Advantage has a bigger place maybe down the road as you age. So if you like going to your doctor and having choices and flexibility, Medigap or Medicare supplement is kind of the plan for you. All right, so that's the basics of Medicare in 5 minutes for you. Okay, you don't have to purchase a plan at all to cover this gap between 80 and 100, but if you don't, you would be responsible for paying the full difference. Purchasing a supplement eliminates or reduces this obligation depending on which plan you select. And I'd like to provide you with one more reason that purchasing the correct supplement is imperative. Okay, so let's just go over an example. So imagine for a moment that something serious popped up on your health radar and you need to have heart surgery. And if you could, wouldn't you want to go to one of the leading cardiac hospitals and be treated by the best cardiothoracic surgeon in the country? I would. And let's just say you've chosen to get treatment at Mayo Clinic. Well, the problem with Mayo Clinic is they're not going to charge 100%. They're going to charge more. Why? Because they can, right? I mean, this specialist is one of the greatest around, and the facilities are just top notch. So let's say they charge 115%. Well, if you buy a Medicare supplement Plan F or a Plan G, which is what I recommend to most of my clients, your plan will pick up that difference, which is known as the Part B excess. And this is really important, okay? Because you don't want a surprise bill. I've had clients who've actually had heart surgery at Mayo Clinic, and that bill was $500,000. And even just 15% of that is a substantial amount. Okay, so this is just another reason that you need to work with an experienced advisor. If you buy the right plan, you don't have to worry about paying any excess charges. Okay, so if plans F and G are the two most common plans I write personally, what is the difference between them? Well, it's pretty simple. Plan F has a higher premium, but is also the most comprehensive. So you can't buy a better plan than a Plan F, period. But something you need to know is that Plan Fs are going away in the year 2020. All right, so it's just a heads up. Then you have the Plan G, which will pretty much become the predominant plan starting in 2020 because you won't be able to buy the F anymore, and so G will become the best plan at that point. The premiums are usually lower than a Plan F, but Plan G has what is known as a Part B deductible, and in 2016, that deductible is $166. So what you can do, and I've done it for you, you're going to receive a packet from me, is that you can kind of calculate, all right, what's a plan F cost every month times 12, and then let me do a Plan G and multiply that premium times 12. Then I need to add in that Part B deductible of $166 because it's just a one-time. And if I can still save money over the Plan F, adding back in that deductible, then I tell all my clients, buy the Plan G, keep the money. There's no, you're going to save a couple of dollars. Do it. Why? You're just throwing it to the wind. So on this slide, you can see what I'm talking about. I'm not going to go over this in great detail, but you can review it yourself if you'd like. It's a chart that we've taken out of the Medicare and You handbook that provides you with a Medicare supplement policy benefit comparison. And as you can see, when you just kind of look at Plan F against a Plan G, as we just discussed, the only difference is that Part B deductible. So this chart's just an easy way for you to quickly compare all the available plans. All right, I'm going to do a quick recap of what we just covered really fast to sum it all up. Medicare Part A is your hospital insurance. Medicare Part B, it's your medical or your doctor insurance. Together, Part A and Part B cover 80% of your healthcare costs as it stands today. Now, Medicare Part C is Medicare Advantage. However, as you now know, I do not generally recommend that my clients select this type of plan due to the limitations we've discussed, unless they're a veteran or I don't know how else to say this, they just can't afford a Medicare supplement. I kind of stay away from the Part C plans because they change every year, and I don't like that. And as people are in retirement and they're on a fixed income, they're trying to figure stuff out for the first time. They don't need a bunch of changes year from year. So in essence, my clients don't technically have Part C. They just have A and B, and then we pair that with a Medigap or a Medicare supplement, specifically either a Plan F or a Plan G, whichever one makes more sense mathematically for them. The last segment of Medicare that I want to cover is Part D, which is the prescription drug portion. You've got to do this. Otherwise, the government's going to assess a penalty on you, and you just don't want to go down that road. Some people think, I don't take any prescriptions, Aaron, so I'm not going to sign up for one of these. I'll just pay that penalty, and then I'll move on. Yeah, well, it doesn't work like that. I got bad news for you. If you don't enroll in this portion, and you don't have other credible prescription drug coverage, you'll have to pay a penalty for the rest of your life. It's not a one-time penalty, so you're going to want to take care of this now. I just tell people, look, it's really not that bad. Most of these drug plans charge a monthly fee that differs based on the specific plan you select. And if you don't take a lot of prescriptions, or any for that matter, what we're going to do is we're going to help you enroll in the cheapest drug card available. You got to have one to avoid the penalty, but you don't have to buy an expensive one. So if you're watching this and you take any prescription medications, you can pause this real quick and just make a note. Email Aaron all of my prescriptions. Okay, I just need the name of the drug, the dosage, and the frequency. So for an example, I take Lipitor, Aaron, it's a 20 milligram, and I take one a day. If you'll send me that data, and then where you go and fill those prescriptions, I go to Walgreens, CVS, Walmart, Fry's, you pick somewhere, tell me, I'll run a drug report for you at absolutely no cost. And I can tell you what's the best card for you based on those prescriptions. Okay, and one of the things I just want you to understand, I read an article not too long ago, and this is just almost just floors me. Did you know that 70% of all Medicare beneficiaries, people that are age 65 plus, are on the wrong prescription drug card? Let that sink in for just a second. What that means is they bought one and they just never changed it, and their prescriptions have changed over time. And so basically, what I'm telling you is they're just spending more money than they need to. You've got to do an annual review of this, and I'm happy to show you how to do it so you don't have to rely on anybody. As prescriptions change as you age, you got to keep this in check. All right, and I can show you how to visit Medicare.gov and use the tool they've created. It's really that simple. All right, let's expose the one exception to mandatory enrollment in Medicare at age 65. So I'm going to make a statement and then I'll back out of it. Medicare is mandatory for everyone when they turn 65, unless you or your spouse currently work for an employer who has 20 or more employees on the group plan and you are on that group plan. Notice I didn't say 20 employees. I said 20 employees on the group plan. If this is the case, you do not have to enroll in Medicare upon turning 65. So if you or your spouse are working for a big employer, like here in the Valley, we have companies like Honeywell, Intel, Republic Services, or if you work for the government or the state, then you are exempt from enrollment until such employment ends and you retire. Now, I just want to mention that you still don't want to take Part A. Medicare Part A is free for most people, and it may enhance the coverage that you have with your group plan. However, there is one limitation to this. If you are in a HSA plan paired with a high deductible health insurance at work, the government prohibits you from taking Part A. So just keep that in mind. All right, this slide is very handy. I recently got a new client and helped her with their Medicare supplement. And a couple of months later, she bought the Medicare supplement. She got a prescription drug card through me. It was really simple, told her about Medicare, and just, she was private. And one of the things that happened that came to light is her husband made a lot of money. And I didn't know that. I mean, when you come in sometimes or I talk to you, I don't ask for your tax return so that you can buy a Medicare supplement. And she was upset with me, and rightly so. And I felt bad because what happened is she found out that her Part B and Part D premiums every month were going to be adjusted because her husband made quite a bit of money. And so I'm going to take the time now to just show this to you. It takes a few seconds, but if you look at this, and I can send this chart to anybody. So if you're a high income earner, you just have to tell guys like me so that I can tell you, hey, look, most people pay $121.80 a month for their Part B premium, and then they just pay their prescription drug amount, and like for an example, $22 a month for their Part D card. But if you make quite a bit of money and you file jointly, your Part B income related adjustment amount paid to a Medicare could tack on $268 more a month per person. So if you have a spouse, and then also your Part D could go as high as $72.90. So if you look on the far right at the far bottom, you can see your totals could be as high as $502.70 a month. And so in this particular situation, I just felt bad because I didn't know. So now I'm going to take the time. Look, if you make a lot of money, understandably, I know you're not happy that you have to pay more, but you are making a lot of money, and that's just the way this works now. So at the end of the day, it is what it is. Okay, I want to take you through some key Medicare dates. These are where most of my questions come from, and so I just want to nip this in the bud so that you just know how it works. In my world, we use the term called your effective date. And so what's that? So that's the first day of your birth month. And don't get hung up here. I'm going to do an example on the next slide. For those of you who are actually born on the first day of the month, your effective date will actually be the first day of the month prior to your birth month. And again, I'll go through an example in a sec. Part A and Part B dates, these are the important ones. If you're on Social Security, right, you're already drawing your benefit, the government automatically assumes you're retired. So what they'll do is they just send you your Medicare card about 3 to 4 months before your birthday. Okay, so you're just going to get it in the mail. You don't have to do anything. But if you're not taking Social Security due to the fact that you're employed, or you just want to delay those credits till full retirement age at 66 and some months, or you've decided to wait till 70 because you just don't actually need it, or you've sat with someone like me and we've done some really smart strategic planning, you're going to have to proactively enroll in Medicare. And you can do that a couple of ways. You can call them, you can go down to a Social Security office, or the easiest way is just to go online. That's what I would do. There's their website, ssa.gov. And you can do that 3 months prior to your effective date. Medigap or Medicare supplement, a lot of the carriers that I deal with will accept a Medicare supplement policy 6 months out before their birthday. So for a lot of you, that's you right now. You're about 6 months to your birthday. There's no reason to hesitate. Go ahead and buy your Medigap. I sent you a packet, sign it, send it back to me. They're not going to start charging you until your birth month anyway, so you can just get it out of the way, and now you're like, okay, one less thing to think about. Unfortunately, good or bad, you can't buy your Part D card 6 months out, but you can buy it 3 months prior to your effective date. So after you buy your supplement, send me back the packet. I can shop out the Part D, send you the application for that too, and get you all taken care of, and then tell you, hey, look, just hold on it to this day, and then date it then. All right, so here's just a real life example. I'm going to use myself. My birthday is September 21st, and let's just assume I was born in 1951, which I wasn't, but let's just say I was. Then my effective date is September 1. It's the first day of the month I was born. And like I previously said on the other slide, just in case there's somebody listening to this, and I have them occasionally, let's pretend my birthday was September 1st. Then my effective date bumps 1 month forward to August 1st. But in my example, I was born on the 21st, so then my effective date is the 1st. If I'm on Social Security, I don't need to do anything, right? No action necessary. They're just going to mail me my card. But if I'm not, and for me that wouldn't happen because I plan to work the rest of my life, then I have to proactively reach out to Social Security. I can go to their website, and I can do that on June 1st. So what I'm saying is 90 days or 3 months prior to my effective date, I can go online and enroll. I can also do the same thing on my drug card. 90 days prior to my effective date, I can buy it. And I can buy my Medigap policy right now, right? 6 months before my birthday. I just want to get it done. That's me. Why sit around? Nothing's going to change. The rates are good for the whole year. They don't really change. In fact, it's better to take advantage of the day the rate you get a quote from me, because I've had people dilly-dally and then the rate went up because a lot of carriers do mid-year rates. So just so you know. And there's no really worries about the premium. A lot of people say, well, I'm already paying for insurance. I don't want to double pay. It doesn't work like that. Some of the carriers do a prepayment. So as soon as you give it to me, they might deduct the first month's premium. But all you're doing is prepaying for that month. They're not going to bill you all the way up. You prepay, and then they won't ding you again until the month after your birthday. But one carrier that I seem to write the most of, they don't bill you anything until your birth month. So no reason to wait at all. All right. I went through that really quick. In a couple of days, you're going to receive another PowerPoint. It's got even more information. But for most of you, that'll do the trick. Here's my name. I'm a CFP. Here's my office address. I get a lot of people in Maricopa County that want to just come over to the office. Feel free to do that. I can go through this more, or you can drop off your app. A lot of you, it's really not that complicated. I'm going to send you an application. There's only a few things to fill in and you're done. You don't have to sit down with anybody. I shop all the carriers for you. So here's my email address. Email me your prescriptions. I need the name of the drug, the dosage, and the frequency. And then there's just my web address, so you can see about my company, watch maybe another video about me right on my homepage. Please feel free to do that. All right, guys, I really appreciate you tuning in. Thank you for your attention. If you have any questions, reach out, but hopefully you feel a whole lot better about Medicare. Thank you.